Obviously, we've been on the market now. We get, great, there's been great enthusiasm by physicians. We see it from, cardiologists here at the ACC, as well as endocrinologists, and there's also, lot of interest in primary care physicians as well. So people understand it, they're getting, used to how to use this in clinical practice. We're not presenting it at this conference, but we just released the top-line results from Odyssey Escape. And the name Escape is because it's focusing on patients who are treated with apheresis. As you know, for patients with FH with the highest level of LDL, sometimes they actually undergo a procedure, similar to dialysis. And for those patients, apheresis is really quite life-altering. We actually were able to show that treatment with Praluent was able to markedly reduce the need for apheresis. We all know the great efficacy that Praluent has in terms of being able to lower LDL. And the LDL that's being controlled, we see, in all the different patients that we've studied. And here's an opportunity to see the great impact as on some of the highest risk patients we have. Well, for our patients who've got the most severe forms of familial hypercholesterolemia, the severe HeFH patients, there are only limited number of centers where they have an opportunity for apheresis, and for those it's an incredible burden on them. To know that Praluent actually is a great option for them and can get them under control without the need for this burdensome procedure, what a great option for our patients. We're excited to present the results coming up soon. Well, we've done studies in statin intolerance, and our colleagues studying Repatha found similar that these drugs work for patients who cannot take statins. Obviously, the key is for patients to be on the maximum tolerated dose of statin, which is really good care, and this complements it for all these patients. When we looked at our data very carefully, we had not seen a neurocognitive signal when we looked at the whole data, but we continue to monitor this. Our data safety monitoring committees continue to monitor this. We're not seeing any signal, but we're going to continue to look because, well, that's what we do. I think that the FDA labels makes it very, very clear as to who this is meant for, and I think that the science is really quite compelling. The genetics, the translational medicine, the phase 3 results, and, soon we'll have the outcomes. So I think that we're all really gratified by the data that we've seen to date, and by physicians continuing to be able to learn about it so that they can actually have this as an option for their patients who need more than they can get on maximally tolerated doses of statin. Well, we have a program, MyPraluent, and that helps physicians to be able to get their patients onto Praluent, and we're going to make sure that patients who need Praluent have access to it. We know that for the most part, physicians who write, we have specialty representatives from the company who can actually help to be able to support the patients there. So that, but I think as from CV development, some of the specific details are not something that I really can discuss exactly. Oh, you do this, and then you get this form, and then you do this form. But it's really a program that's geared towards really being able to help our patients and the physicians who take care of them, because this is important. It is an extra tool. It's an option for patients who need more, and we think it's a great option. And having these options is very, very helpful for our patients, because statins have been revolutionary, but for some people, they can't get down low enough. Their genetics prevent them from getting the benefits that they fully need. And so this is a great opportunity for them to be able to get that LDL under control. The promise of translational medicine, the promise of science, really shows us that reducing LDL, and by inhibiting PCSK9, just as the genetics taught us, can have a tremendous impact on reducing overall cardiovascular events. We're looking at the potential future of really eliminating the risk of LDL with FH. this will just be something that you have like brown eyes or blue eyes, and you'll just be able to control it. It's an incredible opportunity, and we look forward to getting there. I think PCSK9 is still a great buzzword here because the science is so great, and there's still so much more that we're looking forward to learning. We're very much looking forward to the outcome studies. These are going along and are going to provide really important data for our patients there. So I think that this is important, but we continue to be fully committed to being able to treat patients with cardiovascular disease or at risk for cardiovascular events. So we're there for our patients completely. We're really pleased with what we've done with the Praluent program to date. We look forward to some of the additional studies reading out soon about the specific treatment of diabetics. We had a very, very large number of patients who have diabetes in the phase 3 program, but we're continuing to study it because it's really important and continue to understand in all the important subpopulations that we're indicated for. Well, as you probably know, Sanofi's got a very, very important commitment and great heritage in treating patients with diabetes. We know that control of glucose is very important, but similarly, we know that the majority of morbidity and mortality related to diabetes is specifically cardiovascular. And we think that Praluent, on top of maximally tolerated doses of statin, will be an important role in terms of being able to reduce that risk for patients.